Welcome to our channel. Today we'll discuss a common yet often misunderstood condition, gastritis. Now, what exactly is gastritis? It's an inflammation, irritation, or even erosion of the stomach lining. Your stomach is a muscular sac that expands to hold up to a gallon of food or liquid, working continuously to break down what you eat and drink. Now imagine that hard-working lining becoming inflamed or irritated. That's gastritis, to make it simple. And it's not as rare as you might think. In fact, about 8 in every 1,000 individuals in the US experience either acute or chronic forms of gastritis. So it's likely you or someone you know has encountered this condition. Understanding gastritis is the first step towards managing it effectively. Now, you might be wondering, what causes gastritis? Well, the causes of this inflammation of the stomach lining are numerous. It can stem from infections, particularly a sneaky bacterium known as H. pylori, which is often linked to chronic gastritis. Excessive alcohol consumption is another culprit, wreaking havoc on your stomach lining. Certain medications too, especially those like non-steroidal anti-inflammatory drugs, can cause gastritis. It's also important to mention that not everyone is equally at risk. Some people might be more susceptible to gastritis due to factors like autoimmune disorders, where your body, in a case of mistaken identity, attacks its own cells, including those in the stomach. Certain diseases increase the risk as well, so recognizing these causes is crucial in preventing and treating gastritis. But how do you know if you have it? Identifying gastritis can be tricky, as the symptoms vary. But here are some common signs to look out for. One common symptom is indigestion. This might feel like an uncomfortable fullness in your stomach, especially after meals. You might also feel a burning sensation in your upper abdomen. Another symptom is stomach irritation. This could present as a nagging or recurrent pain in your upper abdomen. In some people, gastritis can cause nausea or even vomiting. It's also worth noting that some people with gastritis might not experience any symptoms at all. However, if left untreated, gastritis can lead to more serious conditions. These can include stomach ulcers, which are painful sores in the stomach lining, or even stomach cancer. So what should you do if you notice these symptoms? Well, it's crucial not to ignore them. If you experience these symptoms persistently, it's important to seek medical attention. But don't worry, gastritis can be managed. So how exactly is gastritis treated and prevented? When it comes to treatment, the approach to treating gastritis depends on its cause and severity. If gastritis is due to an infection, antibiotics are typically prescribed to clear the bacteria. For gastritis caused by excessive use of pain relievers or alcohol, the solution may lie in reducing or eliminating that particular irritant. On the other hand, if the inflammation of your stomach lining is severe, your doctor might recommend medications like antacids to neutralize stomach acid or proton pump inhibitors to reduce acid production. In rare cases, if gastritis leads to complications such as ulcers or obstruction, surgery might be necessary. Now, what about prevention? Prevention of gastritis largely revolves around strengthening your stomach's defenses against the acid it produces. This can be achieved through several lifestyle changes. Maintaining good hygiene can protect you from infections that lead to gastritis. Avoiding smoking and excessive alcohol can ease the irritation on your stomach lining. Limiting the use of NSAIDs or non-steroidal anti-inflammatory drugs can also help, as these medications can sometimes cause gastritis. Managing stress through relaxation techniques can be beneficial, as stress can heighten the symptoms of gastritis. Lastly, dietary modifications, like avoiding spicy foods and eating smaller, more frequent meals, can also ease gastritis symptoms. Remember, an ounce of prevention is worth more than a pound of cure. But with the right treatment and lifestyle changes, gastritis can be managed effectively. That brings us to the end of our discussion about gastritis. We learned about its causes, symptoms, and treatments. Remember, gastritis is a common but serious condition. If you or a loved one are experiencing symptoms, don't hesitate to seek medical attention. Thank you for watching, and please like, comment, and subscribe if you enjoyed the video. Also, don't forget to hit the bell notification so you'll be notified when we release new videos. See you next time.